ideally should be screened. And there are several screening modalities. I know the Ministry of Health has adopted what we call the World Health Organization, the 90-70-90 strategy towards elimination of cervical cancer. Yeah. The 90-70-90 strategy, just allow me to explain a bit.
Go ahead.
Yeah, whereby the first 90 means that 90% of girls have received vaccine. This is primary prevention. And then 70% of women are screened with a test, kind of a high performance test, high fidelity test. And that's why I want to mention a bit on the tests and tie it together with the screening. The recommendations from cancer programs is that pap smears should be, at least by 21 years of age, should have a pap test. On the other hand, we in line with the World Health Organization's elimination strategy, it's recommended that we move from pap to a high performance test, which is HPV DNA screening. I'm not saying we should do away with pap, but it's recommended that we do HPV DNA screening. I know of some programs whereby if one has an abnormal pap test, it automatically triggers a reflex HPV DNA testing. On the other hand, we must understand that most women still clear the disease. And so you also don't want to overwhelm the health system by screening women and finding women who will have the disease anyway, by virtue of being young. Maybe they'll clear the disease over time. Yeah. And this has forward to based on those factors. I hope what has informed our. And then those women who have found to have a pre-malignant disease. Pre-malignant means pre-cancer. Quite a number of women still have pre-cancer phase. They should be linked to some form of treatment. And because there's treatment available when you have the pre-cancer phase. Yeah. And the Ministry of Health has rolled out several activities for pre-cancer phase, which can be either ablation, you use cryotherapy, kind of freezing, or you excise. Excise just means you cut off that portion with the disease. And if, of course, if there is, you determine that the disease has spread a little bit further, you can offer radical surgeries. And if it exceeds a certain age, a certain stage, then it's preferred to offer maybe chemotherapy and radiation, so as to manage the advanced stages.
Okay, I get that. Now, back to you, Pamela. I would love for you to just